So the question of is hormone therapy right for me is a question that you really need to have a individualized conversation with your doctor about. Currently, our thinking is that for most women who are within 10 years of their final menstrual period, and ideally under the age of 60, and who have no overt contraindications to hormone therapy, which I'll get to in a second, that for those women, the benefits really most of the time outweigh the risks. So it is always an option for you to discuss hormone therapy with your doctor. The conditions that are kind of a hard stop for most providers are a history of breast cancer, though that can also be a nuanced conversation. So that's, again, something to talk to somebody who's very familiar with hormone therapy and is a menopause specialist. People who have a history of coronary artery disease, meaning they've had a heart attack, they have stents, they have some kind of active heart disease. History of a stroke, because hormone therapy can increase the risk of stroke, so that's generally ill-advised. History of blood clots in your legs or your lungs, though certainly that also has some nuance. It depends on what caused your blood clot. And then history of really severe liver disease, and that's mostly because of how estrogen is metabolized, though we do tend to sort of mitigate that risk by the way that we give estrogen. So unless you have any of those conditions outright, then your risk is either low or intermediate, and really, really, truly does warrant a discussion with your doctor.